Hello, everyone, and welcome back to the Shoulders Up podcast, where we break down complex headaches and dizziness. My name is Dr. Jimmy Pang, and I'm a vestibular physical therapist. So, today's topic is we're going to talk about the Epley maneuver. Now, if you're also a vestibular physical therapist like I am, you should probably be very familiar with this technique. And even, physical therapists who aren't vestibular therapists, your general ortho PT, they also have some pretty decent knowledge about the Epley maneuver. But we have a problem. And the problem is that in the modern healthcare space, whenever someone presents with dizziness or vertigo, most people automatically default to the Epley. Clinicians are doing this, patients are doing this, and even though it's appropriate for a lot of people, this kind of blanket thinking doesn't really serve everyone. And what's happening is people are getting treated with the Epley inappropriately. So, me as a vestibular physical therapist, there are over 20 different vestibular disorders out there. And they all have different qualities. So, a common complaint I hear whenever I get a new patient is that, they had this dizziness or vertigo. Someone told them it was BPPV and they suggested the Epley. And either the clinician tries the Epley with them, or they try to do it at home by themselves, or they come to me seeking that kind of treatment. I have to burst some bubbles and let people know that not every case of vertigo is going to be BPPV. So let's backtrack a little and let's talk about what exactly is BPPV and what exactly is the Epley maneuver. And so the first thing we have to do is define what vertigo is. So many people conflate vertigo to be a diagnosis. This is not true. Vertigo is a symptom, not a diagnosis. So vertigo, we can define it loosely as a false sense of movement of either yourself or your surroundings when that movement isn't actually there. That's what vertigo is. So an example is if you when you were a kid, you might remember you were spinning in circles and then you stop and it feels like the world is spinning around you. That's a great example of what vertigo feels like. And so now that we have that out of the way, let's talk about these vestibular disorders that can create the symptom of vertigo. And there are many, there are over 20 to 30 different vestibular disorders, but the most common of which is BPPV. BPPV stands for Benign Paroxysmal Positional Vertigo, and it's a mouthful, but that name is actually very, very descriptive. So the first word is benign. So BPPV is, even though it's very distressing for a lot of people, it's actually relatively easy to treat, and it really is a very benign condition that the majority of people can expect to make a full recovery from. Paroxysmal just means that it's very sudden. So BPPV is characterized by very sudden episodes of vertigo lasting seconds to minutes. Positional means that it's positionally dependent. So your head has to be moving in certain positions in order to trigger those episodes. Contrast that to another vestibular disorder such as vestibular neuritis, where even when the head is still, especially in the acute phase, they would feel episodes of dizziness and vertigo. And then the final word, V, being vertigo, just refers to the condition causing vertigo. So this is the most common condition that causes vertigo. The majority of cases out there of people who suffer from dizziness and vertigo, you can say that most of them, yeah, definitely it's this condition that we're dealing with. And that's also where the problems start. Our modern healthcare training still isn't really properly equipped to address vestibular disorders. Clinicians often just default to BPPV and prescribe the Epley for pretty much anyone who's dealing with dizziness or vertigo, even though we know that there are actually a lot of conditions that can cause dizziness and vertigo. And this is a problem because the fix for BPPV is pretty quick. We'll get into the specifics a little later, but sometimes when we're not taking all these factors into account, we set our patients up for unrealistic expectations. But their expectation is every case of vertigo is equal to BPPV, and every case of BPPV can be treated with the Epley. And if they come in and I don't think they're dealing with that, then that's my time when I have to kind of burst some bubbles and tell them that the Epley isn't the most appropriate treatment. And oftentimes they've been told, many times I would say, by their physician, who many view as a more authoritative figure than a physical therapist. And when they're told that, they kind of grasp onto this idea, which is very understandable. Vertigo is very, very distressing. Most people want to cling to some kind of answer. But if it's not BPPV, then we are setting up our patients up for misdiagnosis. Okay, so going back to BPPV, what are the mechanics behind BPPV? And so I have a model here. And this model is a model of your inner ear structures, your inner ear balance organs. And then you'll see that there's this kind of central block here. We call them the otoliths. And then you'll see these rings, we call them canals, kind of these arcs. And you'll see that we have three. And so you have one of these in each ear. So you have total of 6 canals, right? These rings, these are canals. And so With BPPV, what we're most concerned with are these canals. We call them the semicircular canals. And these semicircular canals are designed to help you detect rotational head movements. So, for example, when I turn my head right, fluid flows in these canals, and then that flow of fluid is picked up by a hair cell called the cupula. And that's telling your body that, hey, your head is moving. And then that information is sent to your brain, where the brain then integrates that vestibular information with other signals from the body and eyes to produce your sense of balance. Going back to that example of when you were a kid and you spun in circles, and then you stopped, and all of a sudden you had this dizziness and vertigo lasting over. So the reason that happens is because as you spin, you're starting to move the fluid in the canal. So the fluid in the canal is starting to move, and then it picks up inertia. And then when you stop, even though you've stopped moving, the fluid in the canal is still going, and that fluid is still brushing up against the cupula, which is why it makes you feel dizzy. So essentially what happens in BPPV is that we have these crystals in our inner ear, these crystals that are kind of in these otoliths, specifically the utricle. And then what happens for whatever reason is that the crystals become dislodged and they flow into the canal. And when those crystals, we call them otoconia, flow into the canal, what happens is it disrupts the flow of the fluid in that semicircular canal. Specifically, it makes the fluid move more than it should. So when you move your head, these crystals are causing extra movement of the fluid, and then that's why it's making you dizzy. And so how do we treat that? And the treatment is actually very, very simple. Despite how distressing this disorder is, many people are surprised just how easy it is to treat. We're talking 1 to 2 sessions. The average case of BPPV in this country is 1.2 sessions to cure the disorder. What we do is the crystals come out into these canals, and then what we do is we simply maneuver the head in a series of positions to bring the crystals back into where they're supposed to go in the utricle. And then once you bring them back into the utricle, you no longer have any crystals in these canals. You're effectively cured from BPPV. So in this model, I have a ring here, this little metal ring to represent the movement of the otoconia. So here, and then we simply just bring it across with the head maneuvers and bring it back into the utricle to cure the disorder. So that's all well and good. So where do we run into issues? So the first thing is, if you look at this structure, you'll see that there are 3 different canals. So this is the posterior canal with the red. This is the horizontal canal over here with the blue, and then the green is the anterior canal. And then one thing I should also note is if you look at the fluid, if you look at those crystals in the fluid and you see how slowly they move, this fluid in there is actually quite viscous. It becomes clear that you need to go through these maneuvers slowly. That is, in each position, you need to wait for a little bit for the crystals to settle before you go on to continue guiding the crystals throughout the canal. So, like I mentioned, there are 3 canals on each ear. And the most common case, up to 90% of BPPV, is that the crystals get dislodged into the posterior canal. And the way we treat the posterior canal traditionally is with the Epley maneuver. And the Epley maneuver is simply a series of head maneuvers that we do with our patients to bring the crystals throughout the semicircular canal back into the utricle, and then effectively we cure the issue. But if you work in this space of vestibular disorders, what you're going to start seeing is that you're going to see some people who get worse after Epley, or the Epley does not work for them. And that happens because I think people are indiscriminately diagnosing every case of vertigo as BPPV. So before they arrive at the qualified specialist, before they arrive at your doorstep, most of them have already tried the Epley maneuver. And so let's talk about these people, and let's go over some of the reasons why things go wrong for them. How come for them the Epley doesn't work? So the first reason is that they simply treated the wrong canal. So like I mentioned, there are 3 canals on each ear: posterior, horizontal, and anterior. And the Epley was only designed to treat one canal, and that is the posterior canal. So the posterior canal is relatively easy to treat compared to the others. But if we start looking at horizontal canal, BPPV, the maneuvers become much more involved. I really do not advise people to try to address a horizontal canal BPPV on their own. That's when you really need a skilled therapist to help you determine the appropriate maneuver for treating horizontal canal BPPV. So if you're treating the wrong canal, you're moving your head through a series of maneuvers, and the maneuver doesn't actually bring the crystals in the specific canal back into the utricle, and you're essentially just shaking things around in there. And of course, that's going to make you feel more dizzy, nauseous, and experience stronger vertigo. And so that's a common reason why people might not improve with the Epley and feel terrible after. And then, so let's talk about another reason why the Epley might make you feel worse. And this is particularly interesting. This doesn't happen very often, but every once in a while, when you do a maneuver, you can actually end up with something called a canal conversion. For whatever reason, typically it's posterior to horizontal. You do the Epley or similar maneuver for treating posterior canal BPPV. And what happens is, as you guide the crystals through the canal back into the utricle, for whatever reason, they don't settle in the utricle like they normally do, and then they migrate into the horizontal canal. Now, horizontal canal BPPV is typically much stronger than posterior canal. And then when you get one of these canal conversions, it is quite intense. So for most cases of BPPV, people don't really throw up. We don't really see much emesis, especially when it's just posterior canal. But whenever we get one of these migrations, one of these conversions, the chance of, let's just say the chance of throwing up becomes much higher. So of course, it's very distressing. But the good news is with the appropriate provider, horizontal canal BPPV is still actually very easy to treat. You just have to use other maneuvers such as Apiani, Gertzer, Sani, Guffoni, the barbecue roll, Humpert roll. These are all maneuvers designed to treat horizontal canal, but again, these are much more involved. Knowing the proper maneuver for what you see on examination really can't be determined by most lay people, and I would argue even most healthcare professionals. So if you're suspecting horizontal canal BPPV or you experience a conversion, I do not advise anyone try to self-treat. Do yourself a favor and go seek professional help. But like I said, when we get a conversion from posterior to horizontal canal BPPV, it's very distressing. There's probably a pretty high likelihood that the patient is going to, throw up. You may have to come back another time if it's very intense. But like I said, with the appropriate person, you can effectively treat it very well. Let's move on to a third reason why some people feel terrible after the Epley. I've been hinting at this throughout this episode. The biggest reason why that people often feel worse after Epley is that they weren't dealing with BPPV to begin with. Our first example was it was BPPV, but it was the wrong canal. And that's why they felt terrible after the Epley. Then our second reason was, well, yes, it was posterior canal BPPV, but after the Epley was done, for whatever reason, it migrated into horizontal canal, and we had a canal conversion, and that leaves people feeling much worse, and they need further treatment to then clear the horizontal canal. And that's not a reflection on the provider at all. That's just something that happens sometimes. And when it does, we have to address it effectively. The biggest reason I think people don't feel better after the Epley, though, is that when they come to my door, that they actually aren't dealing with BPV at all. So none of the canals are involved. They simply have another vestibular disorder. And I think that's a huge piece that's missing in our education. A lot of healthcare providers aren't necessarily aware of this. And when they tell their patient, oh, you just need to go see a vestibular therapist and they'll do a quick maneuver for you and it'll cure the problem. And then they come to your door and, hey, it's not BPPV. The Epley isn't going to work. It leaves a lot of patients feeling disappointed and, to be honest, sometimes a little bit resistant to further vestibular education. But anyway, suffice it to say that there are a lot of other vestibular disorders. So we can think about things like vestibular neuritis, vestibular migraine, Meniere's disease, labyrinthitis. If you're a vestibular patient listening to this, you may be familiar with some of these diagnoses. There's also 3PD diagnoses like this that many people equate to BPPV. And so these other disorders follow very different treatment strategies and trajectories as compared to BPPV. Like I said, for BPPV, it's often cured in 1 to 2 sessions. Most of the time 1, and then the national average is 1.2 visits to resolve the issue. Contrast that to some of these other vestibular disorders I mentioned. Those we're looking at closer to 6, maybe 8 weeks, and then in very complex cases up to 12 weeks. But I would say most of them can be effectively addressed in 6 weeks. Of course, there are some vestibular disorders that can't be cured, but with those people, getting some high quality vestibular rehabilitation really helps improve the quality of life. So, given all that, the main point I want to make is that for every case of vertigo, I generally do not recommend people try to treat themselves with the Epley unless there's someone who gets recurrent episodes of posterior canal BPPV they've been through before. They kind of understand the signs to look for. They've received a fair amount of education from their vestibular therapist or healthcare provider in the past. Maybe those people I could see that if they get a recurrent episode, they could attempt to self-treat. I think that's very reasonable. But for the most part, especially if you're dealing with the vertigo for the first time, I really do not recommend people try the Epley at home. What could happen is that one, like I mentioned, you could have been treating the wrong canal and you're going to feel much worse after. If a canal conversion happens, it's rare, but if it happens, you're going to be in a much worse spot than when you started. And then if it's not the Epley, if it's not BPPV at all, then what's going to happen is that the Epley is pretty much not going to do anything. It's probably just going to agitate things and make you feel a bit worse. So I know my other vestibular therapists out there can probably relate to this. I hear it all the time. So an example is one time I had a patient and she thought she had BPPV and she told me her doctor did the Epley and of course she threw up and her doctor told her that she was the worst case of posterior canal BPPV he's ever seen. And then so I went and saw her and I did an examination and what I saw was very clear evidence of a vestibular neuritis layered on top with a horizontal canal BPPV. So first thing we did was we treated the horizontal canal BPPV, got that to resolve, and then she had the remaining vestibular neuritis symptoms, i.e. gaze instability. We worked on that. She was pretty young. We worked on it for actually only 2 to 3 weeks, and she had a normal DVA thereafter, and the issue was essentially resolved, and she could return to her life, taking care of her kids, and doing what she has to do. And that's just one example. So I can't tell you how many times I get a patient who says they have posterior canal BPPV, said they need the Epley, or they tried the Epley, or the provider told them they need the Epley, but then the Epley didn't work. And they're at my doorstep with all these different questions. And we really have to backtrack that education and tell them that, what are these other factors that we have to consider? Furthermore, there are some very sinister things that can cause dizziness and vertigo. I'm talking things like stroke, right? That's a very, very serious problem. And you also need someone who's skilled enough to rule out these cases. Luckily, I would say most people with vertigo, especially if it's new, they're quite smart. They will take themselves either to urgent care or the emergency room. And even if those people in those settings aren't the most familiar with vestibular disorders, they are very, very familiar with very serious disorders such as a stroke, and they typically triage appropriately. And what they do is they typically send you home with a referral or advice to seek out a vestibular specialist with, you guessed it, meclizine, which is an antihistamine that helps with dizziness or vertigo. So I hope this was helpful for anyone who may be listening who is dealing with vertigo and has already tried the Epley or has been told to try the Epley and found that the Epley wasn't effective. These are some of the reasons why the Epley might backfire and actually lead you feeling terrible. And so that concludes the episode. You'll find links to my social media and my website in the show notes if you want to learn more.